Dr. McPhail here, McPhail Chiropractic Pain Relief Clinic in Summerville. Thank you for coming to my website. Today I'm going to be talking to you about degenerative disc disease. Alright, and what degenerative disc disease is, it is the most common cause of neck and back pain among Americans today. Now, in our spine we have discs, which are cushions between the vertebrae. Alright, and what they do is they help provide space for that soft, delicate nerve tissue to exit through. Now, like the shock absorbers on our car helps prevent our car from rattling apart when we hit speed bumps or potholes, okay, our disc acts as shock absorbers for the spine as well as help provide space for the soft, delicate nerve tissue to exit through. Now, when functioning normally, alright, what we'll see is we have a vertebrae on top, we have a vertebrae on bottom, okay, and then we have a nice thick disc space in the center there. Okay, and when that's there, we have big wide open spaces for those nerves to exit through. Alright. Then what happens is we fall on our face, we fall on our back side. Okay, at work we got vibration from equipment, we bend and twist, we cough and sneeze, and something happens and we injure the disc. Well, what happens is it begins to deteriorate, okay, in what's called degenerative disc disease. And what happens is it begins to dehydrate and degrade and become much thinner. And when it does so, it starts to put pressure on that soft, delicate nerve tissue, which causes all that pain and discomfort. Now, when this occurs, commonly when patients present to the clinic, okay, they've been to their primary care physician, and they may have gotten muscle relaxers, painkillers, or anti-inflammatories, but unfortunately, short-term, they may provide some symptomatic relief, but long-term, it does nothing to rehabilitate the disc. It does nothing to correct the condition. So it continues. From there, they increase the amount of narcotics, use Percocet, Darvocet, Lortab, things like that. Then from there, they may recommend some pain management. So you go to a pain specialist where they come in and they do injections of cortisone, 2% lidocaine into the joints there. And unfortunately, cortisone does do a good job on inflammation, so short term it does provide some symptomatic relief, but long term it does nothing to rehabilitate those tissues, so the condition continues. Alright, after about 3 to 4 rounds of injections, this is when they start recommending surgical procedures. So they say we're going to come in, we're going to trim off the edges here. Okay, we're going to suck out 20 to 100% of the disc material there, or we're going to put a screw here, and a rod here, and call it a spinal fusion. Unfortunately, research shows that a large percentage of these patients within 3 to 5 years are in a similar condition that they were before they had the surgery, or worse off, having additional surgeries. Okay, and what's called the failed back syndrome. Right now, what we're able to do here at the McPhail Clinic is we use what's called the DRS protocol, and it's a non-surgical solution for chronic neck and back pain, and especially those associated with degenerative disc disease or arthritis of the spine. Other conditions that we're able to treat with this is herniated discs and spinal stenosis. Now, the way that it works, all right, the discs need 3 things. Okay, number 1, they need water. Number 2, they need oxygen. And number 3, they need nutrients. That's what these things need to be healthy. Okay, unfortunately, we have one factor that fights against us at all times. Gravity. Okay, it sucks 24 hours a day, sucks us down to the ground. So 18 hours out of the day, when we're not lying in bed, it's compressing those discs. So they never get an opportunity to heal. So what we're able to do is, with our Acuspina IDD therapy, which stands for intervertebral disc decompression, we're able to create a focused force, okay, directly at the level or levels of the spine of which we're working with. Okay, the most common areas are going to be the lower cervical spine, C5, 6, and 7. These patients will present with neck pain, radiating pain down in the shoulders, arms, wrists, hands, or fingers, or down in the lower lumbar spine, down at L3, 4, and 5. Those are the most common areas. Those patients will present with either low back pain, radiating pain down their legs, numbness or cramping, or they may call it sciatica. Okay, sciatica is actually just a compression of either L4, L5, S1, or S2 nerve roots, your lower back there. So by creating that focused force, what it does is it creates a negative pressure in the disc space, or a pressure gradient, kind of like a vacuum, which allows the disc to begin to suck the water, the oxygen, and the nutrients back into the center where it belongs. Okay, so it can begin to heal from the inside out. Now, as human beings, we're pretty much self-healing organisms, right? You cut your hand, you really don't have to think about it. Clotting factors occur and it heals. Now, if you cut your hand and it's really dirty, you're going to wash it off and give it the proper environment so it can heal. Well, basically, that's what we're doing by decompressing these discs. We're giving those discs the opportunity to heal from the inside out. And in doing so, we're able to decompress the nerves, which gets rid of the pain, as well as through supplementation, we're able to make the disc much stronger and healthier so that it can sustain and remain asymptomatic. All right. Well, a little information there about degenerative disc disease or osteoarthritis of the spine. We have many different methods for other types of arthritic conditions: bone-on-bone knee pain, shoulder issues, frozen shoulder, peripheral neuropathy. So keep an eye out on my website here and look for our upcoming blogs. I'm going to be posting information on them. Thank you so much for staying tuned, and here's to your health.